World Oral Health Day 2025. A happy mouth is a happy mind. On the 20th of March of every year, we ask the world to unite to help reduce the burden of oral diseases which affect individuals, health systems and economies everywhere. Now, what's the purpose of World Oral Health Day? World Oral Health Day aims to empower people with knowledge, tools and confidence to secure good oral health. Why is it important? Oral diseases are a major health concern for many countries, and it negatively impacts people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they are often linked to other serious health issues as well. And yet, there is no reason to suffer. Most oral health conditions are largely preventable, and it can be treated in the early stages. Now, today we are chatting to our special guest all the way from Pretoria. It is Dr. Kwanele Makubalo. Now, he is a dynamic, results-driven dental student and an award-winning leader with a proven track record of leadership and innovation in the dental education sector. As the founder and president of the South African Dental Students Association, or SADSA, he has successfully launched initiatives that enhance collaboration and representation among dental students nationally, continentally, and internationally. Recognized for his ability to advocate for student interest, he has effectively navigated institutional challenges, secured vital partnerships, and elevated his standard on international platforms. He has effectively led various governance bodies, ensuring student representation and continuity of voice within the educational dentistry. He is passionate about public health and dental education. Now, his dedication to inspiring unity and progress within the dental community drives his leadership approach, making him an influential advocate for positive change in dental education and practice. So this afternoon, as mentioned, we would like to welcome Dr. Kwanele Makubalo. Good afternoon, and thanks for joining us.
No, good afternoon, and thank you for having me.
It's always great to have you along. Now, thank you for joining us and thank you for taking your time. Can you share with us, you've been serving in quite a few positions. You were the South African Dental Students Association as the president, as well as the African Dental Students Association as the vice president for external affairs. And I see that you're also with the International Association of Dental Students, the Internal Affairs Bureau, and also a YDC committee member. So you definitely have a lot of experience behind you regarding this.
Yes, definitely. I'm an activist by nature, so I make sure that the place I'm at determines the type of activism that I go through. As a student, I need to make sure that all the injustices that our people and the students are facing, I'm in a better position to advocate for them.
Understood. Now, I'd just like to ask you, Doctor, what is the significance of the World Oral Health Day?
I think its significance is better outlined with the alignment of World Oral Health Day and the principles of public health, which focuses mainly on prevention, health promotion, community engagement, equity, and policy advocacy. So in such campaigns where people are invited to come and make sure that they raise awareness about the importance of oral hygiene and dental health, where it gets to promote dental health education, preventative measures, encouraging people worldwide to participate with their oral health. So it's very significant in that aspect. And as we have said in the introduction, that we have oral diseases that are a major health concern for a lot of countries. And when we meet during the 20th of March in the world to make sure that we participate in a campaign that seek to address the challenges of oral hygiene and dental health that we are faced. So, as I was saying, its significance is mainly on the principles of public health.
Yeah. Now, you were just talking about the introduction that I just shared now, and from that, I would like to just ask, how do you believe the good oral health contributes to overall mental well-being?
I think me and you understand now we're communicating, and what is the tool of communication is the mouth.
Yeah.
And what is the tool of socializing is the mouth. So understanding having a good oral health, having a good happy mouth is having a good tool to socialize, is having a good tool to communicate. And by that aspect, one would find themselves in a position of having a good mental well-being.
Mm-hmm.
So if there's no pain, if there's no discomfort, then there's no reason for one to isolate themselves and not to feel confident about themselves. They will go outside, engage with people, and socialize. And in that way, then they are taking care of their good mental health. On the other hand, if there's pain, there's poor oral health, which can lead to pain, discomfort, which may contribute to anxiety and depression.
Mm-hmm.
So it's connection of oral health and mental health signifies the importance of good oral health to overall well-being of people.
Yeah. Well, it actually does make a lot more sense because, I mean, as you mentioned, that if you are able to smile properly, that's probably your best communication tool. I'm pretty sure nobody's going to smile back at me if I smile and a few teeth are missing or there's a few rotten teeth as well. So that will definitely affect my mental well-being.
Yes,
now,
definitely. And most of the time you find that patients that are presenting with oral health issues, they are complaining on mainly about 4 or 5 things, which is smiling, aesthetics, pain, speech, and function. So all of them, if you can check them, they all lead to how the person is then going to behave socially. So, because if I don't have a good smile, I'm always going to close my mouth. I'm not going to engage people, which isolate myself and results in a poor mental well-being. If I can't speak properly, then at the same time, I'm not going to communicate with anyone. If I'm in pain, I'm not going to speak to anyone. If I can't function properly, if you're having functional problems in relation to dentistry, you can't chew properly, you can't go outside and fun with friends because obviously you are going to suffer from the functional aspects of dentistry.
Of course, yeah. This is Clicks Live, Revitalizing Radio. We are having a discussion with Dr. Kwanele Makubalo. He's all the way out in Pretoria at the moment, and we are discussing World Oral Health Day and why it's important, and also discussing why it's important to have good dental health. Now, Dr. Makubalo is the president of the South African Dental Students Association of South Africa. So he is sharing with us his valuable input and also what he is aware of and how we can actually change things. Now, I've asked you 2 questions thus far, and we also actually had a question from another Clicks customer. If you don't mind answering this one, the question that came through on our line, it says, why am I having severe multiple teeth pain and headaches after having a dental clean? That's normally 1 week or 4 days ago. And how long is the pain supposed to last?
No, thank you. I think that's one question that most of us come across when we're dealing with patients. Mm-hmm. When you are having your professional cleaning, there's rubbing of the enamel which protects your teeth from a lot of things. So the pain that they are feeling is sensitivity, which then wears off with time. It's not really pain, but sensitivity, because understanding when you're scrubbing the enamel, because when you're cleaning within the gums, you're also cleaning on the coronal space, which is the enamel covering the teeth. So when you're scraping and removing the dirt there, you are obviously exposing what's then covered. I'm trying to explain it in the most normal terms. Mm-hmm. We are trying to expose what is then covered by enamel. Then the oral fluids in the mouth then gets to be in contact with the dentinal tubules and yes, with the content of what is then covered by the enamel, which then possesses sensitivity. It wears off with time.
Mm-hmm. Well, thank you very much for that answer. It also explains my visit to the dentist last month, and then I just kind of realized, hey, wait a minute, I am brushing my skeleton. So, thank you, Dr. Kwanele Makubalo. Now, moving on to the next question, I hope that actually answers the Clicks Live listener sufficiently in terms of the answer that you provided for us. Now, moving on to the next question, I wanted to ask you, what is the role of both the dental professionals and the community towards good oral health?
The role of the dental professionals is through preventative care, education, and treatment. Dental professionals are supposed to play that role. I think when you graduate, you take what is called an Hippocratic Oath that speaks on principles and values of ethics, that you are not going to do harm to any patient, but most important, you are going to protect the people that you are serving. So that is where dental professionals are supposed to have their roles regarding the apologies. That is where dental professionals' roles matter more in preventative care, education, and treatment. On the other side, patients and the public's role is supporting the public health initiatives and participating in these educational programs. When we call for biannual visits to dental professionals, the community needs to adhere to that because it is there to assist them.
Mm-hmm. Well, it sounds like a lot of responsibilities out there. Now, just to everyone that just tuned in, we are Clicks Live Revitalizing Radio, and we are discussing World Oral Health Day and the importance of dental matters. And we are chatting to the founder and president of the South African Dental Students Association, SADSA. It is Dr. Kwanele Makubalo, and he's answering some pretty pertinent questions around dentistry and oral health care and how it affects your mental health and your mental well-being. So on that topic, I want to move to the next question. What do you think is the public perception about the contribution of oral health to total health, which is obviously, as I just mentioned now, inclusive of mental health?
Look, I think we need to put context into this one for better understanding. I'm going to mainly speak in South African context, and we then need to put into the conversation the issue of the socio-economic aspect of things. Mm-hmm. So the public really in South Africa, I'm going to speak about people in the rural areas and in the locations where there's no access to dental professionals or dental care. And one then finds themselves in situations where they need to choose between, or one of my colleagues was saying to me, in fact, the socioeconomic status of our people makes them choose between buying food and going to a dental professional. Yeah. And then makes people do not believe that oral health is also for the people who are poor, staying in rural areas or locations, only for those elites and the suburbs and all those things, because there's a decrease in the public, there's a decrease of dental professionals in the public sector with an increased demand from the people. On the other side, you find that there's increase of dental professionals within the private sector and a lesser few people that can afford. So the perception of those who do not afford is then lower because they don't believe that they need to go to a dentist biannually, because obviously there's a question of finances that comes to it, and the question of whether one is going to be able to access a dental professional. I can give you a practical example. Where I'm staying in home in Katlehong, there's only one clinic that offers dental services. So the perception of the people staying there, it's really, they don't believe that oral health contributes mainly to the overall health, and people do not go to dental professionals. They only go there when they are feeling pain. And when they are feeling pain, there is a measurement. They try to measure which one is more painful because of how people associate pain and dentistry. You find that someone is going to say, hey, I've been to a dentist. The pain that I got there is unbearable. So when one has a toothache and they're thinking about the pain that they told them by their friend, they don't go. So it's also aligned to the socio-economic status of our people and how dentistry is more in private practice rather than in public practice.
No, it's true that you mention that, because, I mean, most of us, in a local context, we used to seeing people losing their teeth by 40, 50 years old, and we're prepared to buy dentures and, live life that way. And if we lose one or two teeth, it's just one or two teeth. So, yeah, I can see how that perception actually contributes towards oral health. Now, I would like to move to the next question. How can partnerships between dental schools, local governments and community organizations, how can their partnerships enhance the provision of oral health services? Because as you mentioned, in your situation in Katlehong, there's only one dental service there. So how can these partnerships enhance even more oral health services for the community?
Thanks. I'm going to start from the local, from the government perspective. The government needs to take policy positions that are very intentional about servicing the people. You see, as I was saying, access to dental care is very minimal, especially in the locations and in the rural areas. So there needs to be a policy review on the matters of dental health. And in terms of dental schools need to provide essential care and training for future dental professionals. That is where they're supposed to be. They need to make sure that they train and they produce better dental professionals who are going to value the people and the services, who are going to abide by the Hippocratic Oath that they are going to take. And in terms of the community organizations, collaborations are the ones that matter most. For instance, now we are celebrating the World Oral Health Day, and through such initiative, there must be a collaboration between dental schools, local government, and community organizations to make sure that there is access of dental care to the people, and especially in the most disadvantaged areas. So, for instance, now as the South African Dental Students Association, we are going to be hosting an outreach in commemoration of the World Oral Health Day on Saturday in Katlehong, in a school called Samson Elson School. This is one of the things that we do to make sure that at least we play our part and contribute to enhance the provisions of oral health services to the people. And we're in partnership with the Ward Councillor of Ward 52 in the city of Ekurhuleni, who's going to at least assist us in some of the things that we'll be needing to make sure that our event and initiative be a success. Also, here and there, our dental schools are also participating, but we need more intention on their side to make sure that they participate and they train the students to become the professionals that the country needs.
Mm-hmm. Well, I hope that you succeed in that mission, because you definitely sound like a devoted and passionate dental professional. I mean, especially as you mentioned earlier, you are an activist to encourage more people to take care of their dental health. So, and you sound like someone that actually really, really takes your Hippocratic oath very, very seriously. So, yeah, thank you for that, and I wish you guys all the best of luck for this Saturday in Katlehong.
No, thank you very much, and thank you for having us.
All right, Dr. Kwanele Makubalo, right here online on the air, right with us on Clicks Live, Revitalizing Radio. We are chatting about the significance of World Oral Health Day and how it impacts us. Now, thank you very much again for joining us. Just like to remind everyone that this oral health interview is proudly brought to you by SADA. SADA's vision is to be recognized as the trusted leader and voice of oral health care in Southern Africa. Their mission is to promote the interests and serve the needs of their members, and above all, encourage optimal oral health care for all South Africans. You can learn more about the South African Dental Association by visiting their website www.sada.co.za. Now, all the speakers during this week's Oral Health Awareness interviews are part of the Young Dentist Council Exco. To learn more about the Young Dentist Council, you can visit their website at SADA, that's sada.co.za /Young Dentist Council YDC.